Today, we have another interview in action from the conferences that just happened down here in Miami and Orlando. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, a set of channels dedicated to keeping health IT staff current and engaged. We want to thank our show sponsors who are investing in developing the next generation of health leaders: Gordian Dynamics, Quill Health, Tausight, Nuance, Canon Medical, and Current Health. Check them out at thisweekhealth.com/today. Here we go. All right, here we are from ViVE 2022, and we have Kirk Larson here with Riverside Healthcare. Kirk, we've known each other for a while. It goes all the way back to your NetApp days. How'd you get to Riverside? What was the path to get there?
Yeah, so as you said, I was with NetApp and wanted to get back to the provider side. So I was recruited to be the associate CIO at Rochester Regional Health. So did
Up in New York?
Up in New York, upstate New York.
Okay.
Yep, was there for several years, and then I was really fortunate that I was recruited to Riverside Healthcare. My wife and I are from that area, so it was exciting for us to get back home again. And Riverside, I've really known since I was a kid, just an outstanding healthcare system. And when the opportunity came along to be CIO, it was something that I jumped at. It's a great place to be. Been there about 9 months now and having a lot of fun.
So when I hear Riverside, there's Riversides in probably a lot of places. So tell us a little bit about Riverside.
Yeah, so Riverside is a single hospital integrated delivery network health system about an hour south of Chicago. So we have a primary hub hospital and about 50 locations through 5 or 6 counties. So we really provide the entire continuum of care, for the central Illinois area. And we've been around since the mid-60s. And I'm always proud to say we have tremendous stability. We've only had 3 CEOs in our entire history. So that's really led to a lot of, I think, our success and stability. So we're really a pillar of the community, which is something that's also important to me.
Okay, well, what's your EHR, just curiosity?
So we're on Epic.
You're on Epic, okay.
Yeah, so we installed Epic in January of 2016. Again, I've only been there 9 months, so I wasn't there for the install, but I've said all along, I think they did an absolutely outstanding job with the install. I mean, when you look at the suite of modules we have, we compare with really anyone out there. They really did a nice job and took a very comprehensive approach to that.
That's fantastic. What's top of mind? I mean, you're central Illinois, so is that considered rural healthcare or not really?
Kind of a mix. So our service area, the northern edge of our service area kind of gets into the southern Chicago suburbs, but we also do have a large rural component as well. So kind of a mix of both, but probably certainly more rural and not urban.
So what is top of mind for you as CIO?
A lot of things. So, like I said, we have a really solid instance of Epic, but now we want to take that to the next level. Optimization of Epic, our digital strategy, automation, AI. I think like everyone else here, we're struggling with, finding staff, and, we need to figure out ways we can automate where we can, where it makes sense, have a digital strategy that not only attracts but also retains patients. So it's an exciting time to not be just implementing things, but also optimizing what we have.
The non-urban, that's what we'll call you, the non-urban health systems have a challenge, right? So it's not like you can place 100 bets. You get to place a handful of bets. They have to be well vetted, and you have to look at the ROI. So when you talk about a digital foundation and those kind of things, a lot of times the non-urban players are looking at the urban players and saying, okay, what's already working and that kind of stuff. When you come to a conference like this, what are you looking for when you go on the floor?
No, and I think that's well said, because you're right, Bill. We can't do a shotgun approach. We really need to be very purposeful. So, to me, I'm looking for creative, innovative solutions to these challenges, because we're also not going to be able to spend the money of a massive healthcare system either. So, looking for companies that have good experience, new ideas, and really, ways that they can connect with us strategically and be willing to be our partners, and not so much yet another vendor. So, and I've spent some time on the floor, and there's some interesting companies out there, some of which I was familiar with, and quite honestly, some of them I was not familiar with. So
some of those small booths are interesting. I mean, you literally have like the programmer and the founder sitting there and going, yeah, and in a lot of cases, it's not a PowerPoint deck or anything to that effect. I mean, they're showing you code and they're showing you what they're actually doing. So it's kind of interesting. So you talked about problem sets. So when you come to something like this, you have a set of problems in the back of your head that you're walking the floor saying, all right, am I seeing something around pathology? Am I seeing something around mental health? Or what are the problem sets that you sort of have in the back of your head right now as you're walking around?
Well, I think it really is that digital piece. And I was actually in a focus group yesterday, and people said, what does that exactly mean, or what are the kind of the top three things? And I was not being facetious, and I said number one on that list is figuring out what digital strategy means. Right?
Yeah.
It's one of those things that a few years ago people were talking about AI and cloud and all those other things. So I think the first step is really figuring out what exactly does that mean for us, for the industry, for our patients. And then from there, I think once you land on that, you can think about, what is the digital strategy? How do we automate things? And how can we leverage AI as well? I mean, there's a lot of benefit to, again, in a meaningful way, identifying what that AI is and how that can help with the digital strategy.
Yeah, it's interesting. So, do you have the same problems around like clinical staffing shortages and those kind of things in your market?
We do. It's challenging, and we certainly value every clinical person who's on our team, and they do such special work, and it's as I do rounding throughout the organization. It's really just amazing to see what these folks do every single day, and we need more of them.
So it's people like you that amaze me. I was on a panel once, and I'm sitting there. Okay, I've got 700 people reporting into me. We're spending $250 to $300 million a year in IT and that kind of stuff. And this woman next to me had, I think, 6 IT staff, whatever. But she had all the same things. She had the same government regs. She had the same cybersecurity challenges. She had the same, all the same problems I had with my budget and stuff. I felt bad. I felt like, okay, I'm going to give you a portion of my budget, because she had to figure out a lot of creativity, a lot of really hard work to figure out all the things that I had to figure out. Because she's, again, and we have this thing going on in the Ukraine, and we're on a heightened state of alert. Well, your health system is on a heightened state of alert, and as well as Rush and Chicago. I mean, all the big Chicago systems, but they have staff and money,
right?
And you guys have to follow that and whatever. I mean, how do you, I mean, first of all, amazing, but how do you do it? I mean, how do you make sure that everything's covered and to look at digital innovation?
Yeah, no, I appreciate you saying that, because, Bill, I've been at different organizations in my career. I've been at smaller places, bigger places, and the first thing I would say, and although it sounds a little bit cliche, but it's absolutely true, is I am so fortunate to have such an outstanding team. The folks who work within ITS, and we do purposely call it ITS, Information Technology Services, the leaders and the people on that team, they are so dedicated and so talented. I actually just had this conversation with some folks at Epic about a month ago, just talking about, to me, like our managers at Riverside, I would put them at least on a director level at a lot of other places.
I wouldn't tout that too much to this audience, because I'm talking to health systems now that have like a 48 state hiring strategy, and you have talented Epic people, and they're like, well, I can hire them and pay them New York rates, and that's one of the challenges you guys are facing. But yeah, no, I agree with you. You're only as successful as your team, and you try to provide that leadership that just helps them and gets things out of the way for them so they can get things done.
Yeah, and it's not only the leadership level, it's really the entire organization, the people, and I don't want to name every role, but pick a role, engineers or the desk side folks, the Epic analysts. We're also really fortunate we have a lot of clinical folks within our Epic team. It's so important to provide that perspective, and I've been in some meetings literally in the past few weeks where I've just been so amazed at not only their knowledge but also the collaboration that we have with the operations folks too.
All right, so last question. So you came from NetApp. Does that help you to deal with vendor partners differently because you have been on the other side of the equation?
It absolutely does, Bill. And I was just kind of teasing some folks last night that I have an appreciation for working a booth or striking a deal or negotiating from both sides of the table. So I've also been a consultant, so I've been a provider, a consultant, and a vendor. And
so you walk through the booths with empathy.
I do, with tremendous empathy. So I always look at their shoes and think, boy, those are some long days.
They are some long days. Kirk, thank you for your time.
Bill, it's always a pleasure. Thank you.
Another great interview. I want to thank everybody who spent time with us at the conferences. It is phenomenal that you shared your wisdom and your experience with the community, and it is greatly appreciated. We also want to thank our channel sponsors who are investing in our mission to develop the next generation of health leaders: Gordian Dynamics, Quill Health, Tausight, Nuance, Canon Medical, and Current Health. Check them out at thisweekhealth.com/today. Thanks for listening. That's all for now.